As many of you know, I recently underwent surgery and took some time away from the desk. And it was a situation where I had a cancerous mass removed from inside my mouth. And with me today are two of my heroes, Dr. Danielle Patalico and Dr. Brandon Prentice from the Cleveland Clinic. They are the ones who did the surgery, and once again, they are my heroes now, my two favorite people. And they're here to talk about what I went through and some of the things that you should look out for when it comes to oral cancer. First of all, guys, thank you so much for everything you did. I mean, you guys were incredible. The anesthesiologist was absolutely incredible. And I have to shout out all the nurses on G81. They were excellent, man. They treated me. I felt like one of those Arab kings who come over and get the treatment at the clinic. I mean, they treated me excellent. They treated me well. But first of all, I know you guys are busy, and so thanks for coming over today. Let's talk about oral cancer. Now, I must admit, I mean, I've never heard of oral cancer until I got it. So how popular, how rare is oral cancer?
Yeah, so it's fairly rare when you talk about cancers like breast cancer and prostate cancer. Skin cancer is much more rare than those. So it affects probably about 50,000 Americans a year.
So I'm one of 50,000 people who came to, oh my goodness gracious. So the question is, how do you get it? I mean, what causes it?
Well, some of the risk factors for oral cancer are smoking and alcohol, which you didn't have either of those. And then, you know, some people are just more prone to it.
Is there anything you can do to prevent it from happening?
Yeah, so avoidance of tobacco products is probably the best way.
Thing, yeah.
Keeping your mouth in good condition,
Okay.
so seeing a dentist regularly.
And you know, I found this out by going to the dentist, because there was something he said, well, you know, you need to get that checked out. Got it checked out 6 months later,
Right.
and you know, found out it was cancer. Very interesting. Could you talk about, now this is video, all the cards and stuff I got. It's almost like a dream for me.
Sure.
You know, it's almost like, did this really happen? This is me in a hospital. And, you know, God bless everyone who took care of me. But let's talk about the actual surgery. Now, this is me with the big jaw. Oh, my gosh. Man, oh, man. Let's talk about the surgery. Now, you guys kind of tag team this type of surgery, right?
Yes.
Yeah, so we do these surgeries as two-team approach.
Okay.
So one person is responsible for removing the cancer, and then the other person is responsible for the reconstruction. And so we do both, but in your case, Dr. Prendez removed your cancer, and I did the reconstruction.
The reconstruction, you took skin from my wrist. Right, yes. A little graft from my wrist.
Yep.
So how did you do? I mean, how did you do that? I mean, it's like I don't have that much skin there to begin with. I mean,
so you take the skin and the underlying soft tissue with the blood supply.
Okay.
And then the way I made the incision, we used extra skin from the top part of your arm to cover that defect.
Oh, that's what happened.
So that's why you don't have another scar.
Now I have a big S here. You took out a vein as well?
Yeah, 2 veins and an artery.
2 veins and an artery. Okay, I'm half the man I used to be. All right, doctor. Now after she did, who actually put part of my wrist in my mouth? Who was responsible? You did that as well?
Yeah, I put the wrist, your forearm in your mouth.
Okay.
But he took the cancer out.
Okay, doctor, talk about taking the cancer out. And what kind of procedure was that?
Yeah, so you work inside the mouth, you remove the cancer with clear edges, and they check the margins in the operating room to make sure it was all clear of cancer. And then I took out lymph nodes in your neck.
You did take out lymph nodes.
Yep.
I have the scar to prove it. Okay, so how long was your part of the surgery?
My part was probably about 4 hours, something like that. There's a lot of preparation. You remember when you went into the operating room, all kinds of people there.
Right.
To
I mean,
help
the only
out.
thing I remember is all these people around me,
Right.
and that's all I remember.
Yeah.
I woke up later in the recovery room 9 hours later, and I told my wife and daughter, don't mind me, I'm a little high. You know. Yeah. So I also have to give the shout out to the anesthesiologist. He was the chief of anesthesiology at the clinic. I can't remember his name.
Dr. Abdulmalik.
Oh my gosh.
Yeah.
He says, I got something special for you.
That's a good impression.
Oh my gosh. And it was very special too.
Yeah.
Yeah, but often now this is all you guys do. You just deal with oral surgery. I mean, the oral cancer.
Pretty much any head and neck cancer.
Head and
there's
neck.
oral cancer,
Yeah.
there's throat cancer, there's cancer of the voice box, and then thyroid, skin cancer.
Yeah. What's the survival rate of this?
What you mentioned before, seeing a dentist,
Okay.
finding it early,
Okay.
is
Early,
really
that's the key.
important.
That's
So,
like all cancers,
yeah,
right?
yeah.
Yeah. So what's the message, to individuals out there when it comes to not only oral cancer, but any type of cancer?
Yeah, I think if you have something concerning in your mouth or your throat that's not going away and is persisting for longer than a couple weeks, just get it checked out. It's always better to be safe than sorry.
Yeah.
So what are my chances of survival, Doc?
It's very good, luckily.
That's the important question. How long will I be around?
You're going to be with us
we
for a
have
while.
to keep you around, right?
Yes, absolutely, absolutely.
Yeah.
But I must say, you guys, you did a wonderful, wonderful job. And when I call, you're always there, or the My Chart as we do it now, you're always there. So I just want to thank you so much for what you did. And when you see the nurses on G81, tell them that I love them and I really appreciate what they did. And you guys are absolutely the best, absolutely the best. And as I said, I'm going to be an advocate for early detection of cancer, any type of cancer, because that's the main thing.
I think that's so important for people,
Yeah.
to really be aware of it and know to get it checked early.
Was my surgery difficult than any other? My wife said she saw you after surgery. She said, "You look like you were tired." was it that difficult, or what?
We're always focusing and concentrating intently, so I think we're a little worn out at the end
Yeah.
of
I
the
can
day.
imagine, because how many do you do a day usually?
Usually it's 1 to 2 a
Just
day
1 to 2 a
when there's a
day.
long surgery
When
like
it's
this.
a longer one.
Now, let me ask you this. Now, she took the veins out, but how do you connect that to the veins and the arteries in my mouth? How does that work?
So Dr. Prendez finds vessels in the neck for me, and then I sew the vessels from the arm into the vessels in the neck.
And all of it's connected.
Yeah.
That's absolutely incredible. And people say it's amazing that because I have a flap, you call it a flap in my mouth.
Yeah.
And I'm able to talk, which is a blessing.
Yes.
Because a lot of folk can't talk when they get this done, or they talk a little funny,
Yeah. Yeah.
But you guys did a wonderful, wonderful job. I think,
Thank you.
you know what I think? I think they gave me the best 2 surgeons in all of the Cleveland Clinic. I really do. I really do. And the best anesthesiologists and the best nurses. Maybe it's because I work on Fox 8. I don't know. I don't know. I'm just saying. But Cleveland Clinic, the care is absolutely incredible. That's why you guys are #1 always when it comes to health care. And you're glowing examples of that. So God bless you guys. Keep up the good work. You have been a blessing to me and my family, and I just so appreciate you. No, and thank you for the YouTube that you gave me too.
Oh, no problem.
Danielle I wanted to see the Cavaliers when I was in the hospital, and we couldn't get it at the clinic. So Danielle says, "Oh, okay, well, here." Thank you so much. I appreciate that. God bless
Thank
you
you
guys.
so much
Doctor,
for
thank
having
you.
us.
Thank you. I'll
Yeah.
see you again in August. I'll see you when you get back from maternity leave.
Yep.
And once again, you guys are my heroes.
Oh.
Thank you so much
Thank
for
you.
everything
Thank you.
you do at the Cleveland Clinic.
course.
Now, for more information on oral cancer and more research just from the Cleveland Clinic, you know what to do. Head to fox8.com and look under Seen on TV.